our Lunch Chats, Keeping You Healthy web series. My name is Krista Deans, and I manage public relations for San Ramon Regional Medical Center. For today's presentation, we have the pleasure of introducing Keely Wright. She is our stroke coordinator here at the hospital. And today she's going to discuss the risk and recognition of stroke. And this is very timely because May is National Stroke Awareness Month. Thank you so much for joining us today, Keely.
Thank you.
I will let you take it away.
All right, perfect. Good morning, everybody. I'm happy to be invited to chat about something that's near and dear to my heart, and that would be recognition and managing risk factors for stroke. So I'm going to dive in. I first wanted to just kind of go through some important stroke statistics. These were just published in 2021 and represent several studies, the results of several studies from the American Heart and Stroke Association. So one of the first things that we need to discuss is cardiovascular disease is the leading cause of death at about 42% occurrence rate. The one thing that sometimes people who have had a stroke didn't necessarily always understand is that your one set of pipes from the time it comes out the left side of your heart until it comes back to the right side of your heart. So that cardiovascular system is completely integral to how our brain receives oxygen and glucose. So something to keep in mind is that stroke used to be the fourth leading cause of death. And I've noticed, unfortunately, that it has now moved up to the second cause of death at a rate of about 17%. High blood pressure is the third leading cause of death at about 11%. However, when you look across the United States, high blood pressure has been noted in 47% of American adults. So high blood pressure is the leading cause of stroke and the damage to the cardiovascular system. So we'll talk about that a little more as we kind of progress through the demonstration. Our obesity rates have gone from 30.5% up to 42.4%. We think that this is multifactorial. It has to do with diet. It has to do with lack of exercise, and just overall, the fact that these days, most of our patients and even our children are not getting enough exercise in their time off, especially the ones who are sitting in front of computers all day. Our high cholesterol level ranges from 31 to 41.8%, and that was across all races and genders, and that's a rate, a level of 200 milligrams. An additional level that we would look at, this cholesterol level of 240 milligrams or higher, is sort of in the critical range, and that's an additional 9 to 13% of the population. So overall, cholesterol is impacting about 40 to 54% of our patients. So you can see how the cholesterol, the diet, the obesity rates have definitely, unfortunately, contributed to the rise of the cause of death of stroke being now number 2. So let's talk about modifiable and non-modifiable risk factors, okay? Modifiable are the ones that we actually work with you to try and treat. It needs to be a holistic approach, and depending on when you meet your healthcare provider, if you meet me, you've probably come to the hospital with signs and symptoms of a stroke or a stroke. So we definitely would be a lot more aggressive at working on these modifiables. However, your ongoing day-to-day life is going to have to actually change to be able to reduce your risk. So we talk about high blood pressure, and in the past, a blood pressure of 140 over 90 might be considered normal. That's no longer the case. That's now hypertension. Smoking, it's lovely. I'm from the South originally, and I don't have much of an issue even in my patients who come into San Ramon with smoking. But again, smoking is one of those risk factors that across the world, it's a completely modifiable cause of death. You'll see that obesity is here, an unhealthy diet, and low physical activity. And all three, unfortunately, can contribute to your lipid levels going up. Diabetes, making sure that your blood sugar is under control. And that, again, has an unfortunate but very intimate relationship with obesity, unhealthy diet, and not getting enough activity. Heavy alcohol intake, they continue to support the fact that more than 1 drink a day for females and 2 for males, especially if you're doing it every day, could be considered heavy alcohol intake. The psychosocial factors, especially with what's happened with COVID over the last year. So we have patients who didn't come to the hospital until they'd already had a stroke, which is really unfortunate because we might have been able to minimize the injury. Do patients who've lost their job, so they can't buy their medications, and now their blood pressure is completely out of control because of those sorts of things. So just keeping in mind, I think that those psychosocial factors, and that we can work with you to try and make sure that we get the medications and the treatment that you need. Lipid levels is specifically looking at our cholesterol. And then atrial fibrillation, I have a couple of slides to talk about this as well, is when the atria, the collection chamber of the heart, is not working in tandem with the ventricle to pump the blood smoothly. So that's all of our modifiables. And then I'd like to discuss just quickly your non-modifiables. So if you're male gender, then you're a little more prone to having stroke. History of stroke. So if you've already had that injury, you've kind of shown us that you have a predisposition to, one of these potential modifiable risk factors, or you may actually have a parent or two parents in some cases who have extensive cardiovascular disease. So I always remind the patients and their children that we do get half of our pipes from mom and the other half from dad. So as we increase in age, so does our risk of stroke. So can't change that one for sure. Life Simple 7 is the American Stroke Association plan for essentially dealing with all of those modifiable risk factors. Okay, so you'll see that by having a healthy heart, you get a healthy brain, right? And healthy aging over time. So we want to make certain that you're managing your blood pressure, you're managing your blood glucose, and making sure that your cholesterol levels are as close to normal as possible. That can happen any number of ways, whether it's diet changes, exercise, if you require medications, making sure that you're getting those medications and that you're taking them appropriately. And then sleeping, of course, is important because this is when we all heal. A lot of our brain reset time happens at night during our sleep or days. I used to be a night shift nurse. We request that patients really do stop smoking, and if they are over imbibing, to consider limiting their alcohol intake. That will help with their weight loss and cognitive impairment as well. Eating better. We'll see over time the monitoring of cognitive changes. And there's been lots of information out there about how stroke patients do 3 months or 6 months down the road. And a lot of those cognitive changes come from making sure that we're managing those risk factors. So get physically and socially active. I think that everybody really missed this with the COVID invasion this past year. It's been nice to just be out and walking with your friends again. And then lose weight if you can. Okay, so here's our heart healthy diet, and we'll talk more about that in a second. Just making sure that all of those processed foods, the hamburgers, hot dogs, pizza, my personal favorite, but watching out for that extra sugar and glucose. Having a treat once in a while is one thing, but a daily diet is not okay. If you see the number here at the bottom of the screen, we do talk about the fact that 80%, so 8 out of 10 patients, their heart disease and stroke was preventable. So it's important that we just kind of keep it to the Life Simple 7, making sure that we're moving, making sure that we're sleeping, eating, and then just handling our disease process. So the high blood pressure that I was talking about earlier definitely equals a higher risk of stroke. I want to point out that a normal blood pressure is 120/80 and below. Most people have a stroke with high blood pressure. They didn't realize, or they weren't treating it correctly. So just being aware of how important your blood pressure is for the perfusion of your brain. Okay, your life expectancy is 5 years longer at age 50 for people without high blood pressure. So I think that alone is a sobering statistic and should definitely make you get your blood pressure checked, please. Okay, I wanted to talk about how blood pressure actually damages your blood vessels. And so it's a couple of things. You're probably looking at my screen, and this is the normal healthy pressure in a normal healthy vessel. So 120/60. This is just fine. There's no damage being done here. As over time, that blood pressure starts to creep up, what you'll see is that it's like having a garden hose that's going up and down with, oh, is my blood pressure normal, or oh, is my blood pressure increased? So the way that I like to explain hypertension to my patients is to say, your blood pressure of 120/80 is, go to your kitchen sink, turn it on. That's a normal blood pressure from that flow. Now, when your blood pressure is pushing 180 on the top to 220 over maybe 100 to 120 on the bottom, I want you to walk into your bathroom, take your bathtub nozzles and open them all the way up, wide open. And then think about the fact that that's what that blood pressure is. So what will happen is, again, getting back to what I was saying, the blood leaves the left side of the heart and goes all around the circuit till it comes back to the right. Some vessels, like in our neck, bigger vessels. Some, as we get further out, are smaller, okay, like in our eyes, our kidneys, our extremities. And so over time, when those vessels become damaged, and by the way, it's happening silently, you don't necessarily feel it. Unfortunately, it causes problems with your neurovasculature. So our patients end up with, oh, wait, I have kidney damage. How did my blood pressure damage my kidney? Well, remember that your kidney, which filters everything, it's billions of little tiny tubes, like smaller than hair. And I want you to try and imagine shoving that bathtub blood pressure through those teeny tiny vessels. And then you'll understand that that's why hypertension is so dangerous to our patients. You'll see in the third picture here, that over time, those damaged walls are one problem because they might start to be torn or abraded. And then you get plaque. So here is our hyperlipidemia and our cholesterol. So over time, this becomes a rough area, and then platelets, because the body tends to like really smooth areas, will come and link up in here. And the problem will be, of course, if the blood is trying to come this way, and now I'm completely occluded, everything down here is not getting any blood flow. If you have diabetes, you have 2 times a higher risk for stroke. And the American Heart Association and the American Stroke Association are working really closely this year and moving forward. One of our initiatives that we're really focusing on are making sure that we help diabetics get their blood sugar under control. Okay. And under control, we're saying, let's keep it 80 to 130. Okay. By having that, you're decreasing your potential stroke risk. You're decreasing your potential stroke complications. And I'll talk about the coordinating of the elevated glucose in just a second, because what I want you to think about is, if I had honey in a jar and I try to pour it, does it pour quickly? No, right? It's thick, it's slow, it's sticky, it crystallizes. And that's exactly what is damaging all of those teeny tiny blood vessels. It's why we see complications right in the feet, the hands, the eye, the kidney for our diabetic patients. So we definitely want to make sure that we're not adding to the risk of having a stroke. The coordinating follow-up on an elevated glucose is important because lots of times patients will say, oh, I knew it was kind of up, but I didn't really want to do anything. And, so a lot of times they don't do the follow-up. They're not coming back for their labs or checking their blood sugar. It's definitely a case where you're kind of like, if I just don't look, it won't be a problem. However, if your blood sugar's in the 200s, close to 300, I want you to think about that honey and what it's doing to all of the blood vessels. And remember, the blood vessels take the blood that brings oxygen and nutrients to your body. And then as it goes back to the heart, it takes all of the toxins, the trash, to be cleaned up. So definitely, please go get your blood sugar checked. Atrial fibrillation is when you have an unusual heart rate and rhythm. And so what happens is, over time, these atria that we're talking about can become damaged. Okay, so let's look at the normal one. Normally, the electricity goes across the heart this way, then it comes down this way and goes here and here, so that the blood that's in this chamber goes down into the ventricle and then gets pumped out to the body. Okay, in atrial fibrillation, what's happening is, instead of lub dub, which is normal, this is how your heart normally does. I squeeze all the blood and then I pump all the blood out. With atrial fibrillation, have this. I have vibrating at the top of the the system. And the problem with any time you make blood turbulent is that it might clot. And unfortunately, if you clot and then it goes down into the ventricle and gets pumped, you could, in fact, have a stroke. If it's going to your head, if it goes to your lungs, you would have a pulmonary embolism. So atrial fibrillation definitely needs to be managed. So in the next slide, I'll talk about what those risks are. But again, here it's just fibrillating. It creates a clot. The clot then, because the brain is one of the first places, of course, to get the blood because it needs it. So that's how we end up with stroke, unfortunately. So atrial fibrillation looks like a fluttering sensation in the chest. Patients will say like butterfly or just fluttery. Okay. You might have a rapid heart rate or palpitations, like, right, that increased. You'll feel like you've been running. Your fatigue and weakness comes from the fact that if it's doing this and pumping and this, it's not very organized. So you're not getting as much blood flow, which could in fact make you feel short of breath, or you could have chest pain from it. And then worse would be lightheaded, dizziness, confusion. So if you're having any of these signs and symptoms, just be aware, like fatigue and weakness, the lightheadedness could be signs and symptoms of stroke, or we have something else going on that's cardiac. So if you have atrial fibrillation, we want to make sure that we monitor you and your medication regimen, because it's very important that you not have a stroke because of this uncoordinated rhythm. Healthy diet is a reminder to just eat most vegetables and fruit, okay? You can eat some of those grain foods or starchy vegetables, but not too many potatoes, not too many, French fries. So legumes, fish, seafood are always good. And especially nuts, you can get some of your fat in your diet from your milk, yogurt, and cheese. Just keep it on the lower end of the fat scale. That doesn't mean brie, sorry. Healthy oils, nuts, and seeds are also like an intricate part of just really helping your heart do what it needs to do so that it keeps you healthy and blood flow to all of your organs. You'll see down here in the very tiny print that we recommend cutting back on junk foods, right? Takeout food, all of your sodas, anything that could be high in sugar, salt, or unsaturated fat or trans fat, because those are going to continue to cause problems inside that vessel. Smoking and drinking excessively increases our stroke risk. However, exercise really does protect your brain and body. And I think that people who were kind of stuck inside over the last year have really come to realize, I know I did, I'm a gardener, and I feel so much better when I get outside and get moving around a little bit. So I encourage you to do so too. So in closing, I just want to go through a couple of things. I want you to be fast to recognize stroke. So you'll see that B is any trouble with balance or vertigo, or I'm dizzy. I don't know what's that kind of thing. Consider that might actually be a sign or symptom of stroke. And the reason that we've added this B and the E to the FAST algorithm was because the balance part of our brain is back here in our cerebellum. So we want to be certain that it's deep in the brain, that if something's going on, we get it as soon as we possibly can so that we can help minimize your injury. E for eyes, so any loss of vision, blurry vision that's new, any double vision, or like it feels like you might have a vision field cut, that's definitely. Face, so one side of the face is weak or numb, the face can appear uneven or drooping. I've had a couple of patients who, when they came in, didn't realize that they said they didn't think they were having a stroke because they didn't have a facial droop. You do not have to have a facial droop to be having a stroke, okay? A, arm weakness or numbness, so it's arm or leg, okay? If you have, I saw a patient today and she was telling me she has numbness every day, and I said, okay, but if that numbness changes, that could be a sign of something else, okay? Speech, any slurred speech, any trouble being understood or understanding would definitely be something for us to take a look at, because we want to make sure that we keep you talking to your loved ones. T is for time, and lots of people have told me that they didn't quite always realize that when you dial 911 and they get there and assess that you look like you're having signs and symptoms of a stroke, they get on the phone, take you to the nearest stroke center, and when you get there, the stroke team is standing there waiting for you. You have the physician, you have the nurse, you have the lab, you have the stroke coordinator, and we want to make sure that we get your workup as fast as possible so that we can figure out what's making you feel bad. when you're all through the emergency room part, and perhaps you've had a transient ischemic attack and your symptoms are resolving, you're still going to be worked up so that we can figure out what brought you to this spot. If you had numbness of your face and it's gone, I'm very happy it's gone, but we really do need to investigate why your face was numb. So I'm going to close this out. I want to remind everybody and invite you to check out the website because we have a stroke quiz on there. You can follow us on Facebook. And if you want to learn more about stroke or you have questions for me, my contact information is here. So thank you.
Thank you so much, Keely. It's wonderful information. And like we talked about, it's not only timely for this month because it's Stroke Awareness Month, but really all year. So we really appreciate you taking the time to talk about it.
Perfect. Thank you.
Take care, everybody. Have a great day.